Narcolepsy is a chronic disorder that affects the brain's ability to regulate sleep-wake cycles. People with narcolepsy often find it difficult to stay awake for long periods during the day, no matter the circumstances. They often feel very drowsy or sleepy and often have difficulty concentrating. This condition can lead to sudden, uncontrollable episodes of falling asleep during the day, known as sleep attacks. Narcolepsy is more than just feeling extremely tired. It is a disorder where the boundaries between being awake and asleep are blurred. The condition affects the brain's hypothalamus, which is the part responsible for regulating sleep and wakefulness. Normally, when we sleep, the brain goes through several stages before entering rapid eye movement or REM sleep, which is the stage of sleep associated with vivid dreams. These stages usually take about 60 to 90 minutes after falling asleep. However, people with narcolepsy often enter REM sleep within minutes of falling asleep, even during the day. This unusual sleep pattern is at the root of many narcolepsy symptoms. Narcolepsy affects approximately 1 in 2,000 people in the United States, though it's believed to be underdiagnosed due to its complex symptoms and similarities to other conditions. It typically begins between the ages of 10 and 30, but it can occur at any age. Types of narcolepsy. Narcolepsy can be classified into two main types: narcolepsy type 1 and narcolepsy type 2. Type 1 narcolepsy, formerly known as narcolepsy with cataplexy, is characterized by excessive daytime sleepiness in addition to cataplexy. Cataplexy is a sudden loss of muscle control triggered by strong emotions, such as laughter, surprise, or anger. So in type 1, the person may collapse or experience slurred speech but remains conscious. Narcolepsy type 2, on the other hand, does not involve cataplexy. Individuals with type 2 experience similar sleep attacks and excessive daytime sleepiness, but without the episodes of muscle weakness. Causes of narcolepsy. The causes of narcolepsy are complex and not fully understood, but researchers have made significant progress in recent years. For type 1 narcolepsy, the primary cause appears to be a loss of neurons in the brain that produce a chemical called hypocretin, which plays a crucial role in regulating wakefulness and REM sleep. In type 1, there is a significant reduction or complete absence of hypocretin, which is thought to be the main cause of the disorder. This loss is believed to be the result of an autoimmune process, where the body's immune system mistakenly attacks and destroys these specific neurons. Some researchers also believe that infections, particularly viral infections, may trigger the autoimmune response that leads to narcolepsy type 1 in genetically susceptible individuals. The causes of type 2 narcolepsy, on the other hand, are less clear. While it's known that hypocretin levels are typically normal in these individuals, the exact mechanisms causing their symptoms are not well understood. It's possible that other neurotransmitters or brain regions involved in sleep regulation are affected in ways that we haven't yet identified. Symptoms of narcolepsy. The symptoms of narcolepsy can be quite varied and often develop gradually over time. The most prominent symptom, and often the first to appear, is excessive daytime sleepiness. People with narcolepsy experience an overwhelming and persistent feeling of sleepiness during the day, regardless of how much sleep they get at night. This isn't just feeling a bit tired. It's an irresistible urge to sleep that can occur at any time, even in the middle of activities. Many people with narcolepsy describe it as feeling like they're in a fog or moving through molasses. They might find themselves nodding off during conversations, while eating, or even while driving. These sleep attacks can last for a few seconds or several minutes and often occur without warning. Cataplexy, which is a symptom unique to type 1 narcolepsy, is perhaps one of the most striking and unusual aspects of the condition. Cataplexy involves a sudden, temporary loss of muscle control triggered by strong emotions. These emotions can be positive, like laughter or excitement, or negative, like anger or fear. The severity of cataplexy can range from mild weakness, such as a slight drooping of the eyelids or slackening of facial muscles, to complete loss of muscle control leading to collapse. People experiencing cataplexy remain fully conscious during these episodes, which can last from a few seconds to several minutes. Imagine laughing at a joke and suddenly finding yourself unable to speak or move, all while being fully aware of your surroundings. It's an unsettling experience that can have significant social and emotional impacts. Another common symptom of narcolepsy is sleep paralysis. This occurs when a person is unable to move or speak while falling asleep or waking up. During these episodes, which typically last only a few seconds or minutes, the individual is conscious but unable to move their body. Some people also experience hallucinations during these episodes, which can be terrifying if you don't understand what's happening. Hallucinations are another potential symptom of narcolepsy. These can occur while falling asleep or while waking up. These vivid, often frightening experiences can involve all the senses and feel incredibly real. People might see strangers in their room, hear voices, or feel things touching them that aren't actually there. Disrupted nighttime sleep is also common in narcolepsy, despite the excessive daytime sleepiness. People with narcolepsy often have trouble staying asleep through the night, waking up frequently. This fragmented sleep can contribute to feelings of fatigue during the day. Automatic behaviors are another potential symptom. This occurs when a person briefly falls asleep during an activity, but continues to perform that activity without conscious awareness. For example, someone might continue writing, but the words become gibberish, or they might continue driving but miss their turn. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of narcolepsy. The first step of diagnosis typically involves a detailed medical history and physical examination. The doctor will ask about sleep patterns, daytime sleepiness, and any episodes of cataplexy or sleep paralysis. They may also ask about family history, as narcolepsy can sometimes run in families. One of the primary diagnostic tools for narcolepsy is the multiple sleep latency test. This test measures how quickly a person falls asleep during the day when given the opportunity to nap. It's typically performed the day after an overnight sleep study called a polysonogram. During the multiple sleep latency test, the patient is given 5 opportunities to nap, spaced 2 hours apart. People with narcolepsy tend to fall asleep very quickly during these nap opportunities and often enter REM sleep rapidly, a phenomenon called sleep onset REM periods. Other than that, the polysonogram itself can also provide valuable information. This overnight sleep study records brain waves, eye movements, muscle activity, and other bodily functions during sleep. While it doesn't diagnose narcolepsy directly, it can help rule out other sleep disorders that might cause similar symptoms. In cases where type 1 narcolepsy is suspected, a doctor may recommend measuring hypocretin levels in the cerebrospinal fluid. This requires a lumbar puncture to collect a sample of the fluid. Low hypocretin levels strongly suggest type 1 narcolepsy. Treatment for narcolepsy. While there is no cure for narcolepsy, treatments can help manage symptoms and improve quality of life. Medications are a key component of narcolepsy treatment. Stimulants are often prescribed to help with excessive daytime sleepiness. These can include modafinil, armodafinil, or amphetamine-like stimulants. These medications help promote wakefulness during the day, allowing people with narcolepsy to stay alert and focused. For cataplexy and other symptoms related to abnormal REM sleep, like sleep paralysis and hallucinations, antidepressants are sometimes used. Certain antidepressants can suppress REM sleep, which can help reduce these symptoms. Sodium oxybate is another medication that can be particularly effective for both excessive daytime sleepiness and cataplexy. In addition to medications, lifestyle modifications play a crucial role in managing narcolepsy. Maintaining a regular sleep schedule is important, with consistent bedtimes and wake times, even on weekends. Short, scheduled naps during the day can also be helpful for managing sleepiness. Exercise can also improve alertness and help regulate sleep patterns. However, it's generally recommended to avoid vigorous exercise close to bedtime. Safety is an important consideration for people with narcolepsy, particularly when it comes to driving or operating machinery. Some people with narcolepsy may need to avoid driving or may only be able to drive for short periods. It's important to discuss these issues with your doctor to determine what's safe in each individual case. Now, we want to hear from you. Do you or someone you know have narcolepsy? What symptoms did you have at first? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.